Carly. I'm a student nurse.
Hi, I'm Jason. Yes.
Alright, so today we're going to be talking about hand hygiene.
Okay.
So why it's important, what are the 5 stages of hand hygiene, and how to actually do hand hygiene.
Okay.
Okay, so I'm going to start with why hand hygiene is important. Do you have any ideas?
I think it's to stop infection spreads and all of that.
So infection control, because you don't want to take germs in your hands to your patient, nor do you want your patients to give you germs that you're going to take home to your family or to other patients.
Yeah.
Alright, so what are the 5 moments of hand hygiene? I have a little poster for you to look at.
Okay.
Study it, because there's going to be a test on it in a moment.
Alright.
But first let's tell you. So the first stage is before touching a patient. So why? To protect the patient against any germs that you've gotten from your surroundings before you go to see them. So before a procedure, again, if you have germs on your hands, you don't want to give them to the patient. And then after a procedure or exposure to bodily fluids, to protect yourself and anybody else in your healthcare surrounding. After touching a patient, again to protect yourself and anybody else in your healthcare surroundings. And after touching a patient's surroundings, because you don't know what germs are living in the environment. You don't want to take them away to another person. Alright.
Has he just been driving around?
Do you think you've got that?
I think so, yes.
Alright, so now we have a little
Give it a
quiz.
go.
So what we got is, you have to match the arrow to the number. And then we'll see how well you do. Go for it.
Alright. So first, we need to go for before touching a patient.
Number 1. Yep.
And then before a procedure.
Number 2. Yep.
Number 3, after a procedure.
Yep.
Number 4, after touching a patient.
Yep.
And 5, patient surroundings.
Well done. Compare the pair.
Compare the pair. Yep.
Pretty good. Alright, well done. Alright, now the second bit we're going to do is how to actually do hand hygiene.
Okay.
Now we're not going to do it with soap and water, but you should, especially if your hands are visibly soiled. We're going from room to room. Aquagel is fine, and that's what we're using today.
Okay.
Okay, Aquagel your hands. We'll do it together. Practice our hand rubbing technique. Alright, so first, roll up my sleeves. You go around the circles, and then you go on the backs.
Back.
Then the other hand, and then cross your fingers over. So do the front, and then you can do your fingers, and do your thumbs. Make sure you get that all of it. And then more fingers. Alright, and then let them dry. Seems pretty easy? Alright, do you think you can do it again by yourself?
I think so.
Alright, we won't use the hand gel, just show me the actions. So first, what do you do?
Alright, so it's just the general
Yeah, in
phase.
the middle. And then,
Then it's the back of the hands,
Yep.
both sides.
Yep.
And then front. In between.
yep.
Thumbs.
Well, you missed a step.
Ooh. Fingertips.
You have to do fingertips. And then thumbs. And then fingers.
Fingers.
In the palm. And then let them dry. Alright, but I will mention, when you do it with a tap, when you get your paper towel, to use a paper towel to turn off the taps. You can't touch them with your hands. Alright. Do you have any questions?
No, I think that's pretty self-explanatory.
Good. I'm pleased. Well done.